Hello, my name is Keith Morse, and I'm a pediatric hospitalist and medical director of clinical informatics at Lucille Packard Children's Hospital. I'm also a graduate of Stanford's Clinical Informatics Fellowship Program, and I want to talk today about informatics' role in innovation. Particularly here at Stanford, with world-class medical care and data science expertise, the potential for clinical informatics to drive innovation is substantial. Stanford offered the nation's first ACGME-accredited Clinical Informatics Fellowship in 2014. Since then, over 40 informatics fellowship programs have opened up nationally, with more being added every year. The reason for this explosive growth is twofold. First is the growing ubiquity of electronic health records and other health IT systems that collect patient and other types of data that have immense potential to improve care. The second is the growing recognition that realizing this potential is exceptionally difficult. Understanding why this is so difficult and strategies to overcome these difficulties are what informatics fellows are taught. Coursework includes such things as medical ontologies, interoperability standards, database architectures, and federal regulation. But the real magic of the fellowship is the on-the-ground exposure these trainees get to how health IT decisions get made within a health system. Our fellows attend meetings with CMIOs and other leadership and participate in national interoperability work groups. They see the needs, the priorities, the ambitions of a health system in action. They also work with researchers from our School of Medicine in computer science and bioinformatics. This is an immensely useful position to drive innovation. On one hand, these fellows are on the front lines and see the pain points of a health system in action. On the other, they have a wide perspective that encompasses 2 hospitals, a school of medicine, and a wider informatics community. They are able to see problems locally and connect them with diverse potential solutions. Our fellows have driven such projects as implementing policies to dramatically increase interoperability across Northern California, develop data-driven vital sign parameters to reduce alarm fatigue, create frameworks for responsible implementation of machine learning, and implemented system-wide improvements to increase physician efficiency and decrease burnout. A more recent example is a tool to protect adolescent confidentiality when sharing notes with patients and families. As some of you may know, the 21st Century Cures Act is a federal piece of legislation that, among other things, mandates that health systems share their notes with patients and families. This is wonderful, except in the case of adolescents who may be discussing things with their providers that they'd rather not share with their patients. For some types of medical care, physicians are legally barred from sharing this type of patient information with parents. So, how do health systems comply with the 21st Century Cures mandate to share notes while maintaining adolescent confidentiality rights? And how do we do this at scale? To address this challenge, we partnered with researchers from the School of Medicine and Lucille Packard Children's Hospital to build an NLP algorithm to automatically identify this sensitive content. The goal is that we'll be able to review physician notes before sharing them with families in a way that is both appropriate for clinical care and sustainable within the health IT system. This adolescent confidentiality issue is something that children's hospitals nationally are grappling with. Here at Stanford, we are uniquely equipped with a strong research community and clinical informatics fellows who are able to connect that research with needs from the clinical environment to drive innovation.